Hi guys, my name is Cassie, and today I'm going to be talking about the historical accuracy of John Snow, basically verifying his first account of epidemiology. So first I'm going to talk a little bit about why epidemiology is important in other aspects of our life and kind of why it was important for John Snow to be correct that first time around. So, public health decision making is actually an important factor in most communities, as it's a sector that can apply to a multitude of people. And one major part of this decision making is making them based on careful analysis of accurate data and proven research finding. Yet, it's hard for most to know when data is significant or valid, and this is where epidemiology comes in. So, epidemiology has been defined as the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to control health problems, validating it as a pretty key tool in public health decision-making. Modern epidemiology uses tested scientific methods to understand the pattern of disease and health and the root causes/determinants of health problems, which is essentially the who, what, where, and why surrounding public health concern. It also helps apply this information to prevent illness and injury, to protect people from harm, and to control health problems. In this way, epidemiology is useful to public health practitioners that are making decisions and recommendations about program and spending in public health. So this is just a scenario that is included to help visualize kind of why epidemiology is important in these cases. Essentially, you're responsible for HIV/AIDS prevention in your community, and you need to make recommendations for the next year program. So without epidemiology, you conclude that due to the 75% increase in AIDS cases in your community, there needs to be an increase in funding for prevention and control activities. This essentially decreases fundings for other programs, such as the tobacco bylaw program. So what you've done is moved funding, but was that the right choice? Using epidemiology, you look more into why cases of HIV/AIDS have increased from 4 to 7 between 1999 and 2000. Now, these concepts included in epidemiology prompt you to look at the denominator/population of people as well as the new number of cases. This concept helps you realize that calculating percentage changes and comparing small numbers can indicate dramatic differences which aren't entirely accurate. And upon this additional research, you find out that your town population has increased significantly between these two dates and conclude that there really is no increase of rate of HIV cases, as you've now accounted for the increase in population size. So, in this case, you recommend no budget changes and continue to monitor the situation. Now that you know a little bit about why epidemiology is important in other human aspects, I'm going to use an article written by Warren Winkelson Jr. to kind of explain who John Snow was, the data that he found, the experiments that he did, and why it was important. So, Dr. John Snow was a British physician who is considered one of the founding fathers of epidemiology due to his work identifying the source of cholera outbreak in 1854. Now, when cholera broke out in London, theories were created to help explain the rapid spread of the disease through the community. The most popular one was that cholera was an airborne sickness. However, John Snow's theory focused around the idea that cholera actually spread through contaminated water. Contaminated, meaning human excrement, as proper sanitation had not yet been established. Now, Snow used 3 approaches to test his theories. The first approach he used is he conducted an analysis of the geographic distribution of cholera cases in London in relation to particular water supplies. The second one he did was he conducted study of cholera incidents among users of various water supplies by looking at past medical records. And the third one was he conducted an investigation of intense cholera outbreak in the Golden Square neighborhood of SOHO, where the Broad Street pump was located, looking at who did and didn't have cholera. The result of Snow's ecological study on distribution of water supply in London led to the discovery that the districts with the highest rate of cholera mortality, which were the East and the South, were served by water companies that obtained their supplies from known polluted parts of the Thames. And the districts with the lowest rates, which are the West, North, and Central, obtained their water from relatively uncontaminated sources, and you can see that in Figure 1. Now, he also did an additional ecological cohort study by obtaining cholera mortality data for the districts according to the water company supplying each district. According to that data, those supplied by Southwark and Vauxhall, which is one water company, had higher cholera mortality rates than those supplied by both Southwark and Vauxhall and Lambeth, which is the other. Those supplied by Lambeth had no cholera deaths. And coupled with the sewage amount contained in the water these companies drawn from, these results further solidified the idea that contaminated water was responsible for the transmission of cholera, and you can see all that data in figure 2. Now the final experiment he did was a spatial data map. Because conditions provided the perfect opportunity, Snow looked specifically at the SOHO district, mapping 13 public wells and all the known cholera deaths in that area. He noted that the spatial clustering of cases were around one pump in particular, the Broad Street pump. And upon inquiry of other deaths not within a close proximity to that pump, he discovered that it was used far more often than previously thought. Now, my research question is, how accurate was Snow's assumption in assuming that the Broad Street pump was the root pump in causing the influx of cholera mortality in the district of SOHO? And I'll figure that out using GIS, specifically the tools direct node distribution, mean center, and Thiessen polygon. The first tool I used was directional distribution, and this created an oval that you can see here. Inside the oval is a central tendency, or where most of the cholera deaths spatially seem to be gathered within, basically looking at the mean. Now the direction of this oval tells me the direction that the deaths spread, and you can see that the shape is slanted and stays relatively close to how Broadwick Street runs instead of being just straight across. My mean center tool, which is the pink that you see, finds the absolute center of where the cholera death concentration seems to be the highest at. And as you can see, it is right in the middle of our directional distribution and again in the middle of Broadwick Street. To help visualize the distribution of cholera deaths, I used point density to calculate where the most cholera deaths were located. Now with this, I didn't just use the mean, which is what was used before to figure out directional distribution. I used all of the deaths weighted the same individually. And we can clearly see here that there is one area on the map where it is solidified that there is a very high density of cholera deaths in that area. Now going back to the distribution of pumps, which is in the lower left-hand corner, we can see that there is one pump in particular close to this high density, which is the Broad Street pump. With this information, I wanted to additionally figure out why this pump had such a high concentration of deaths, which should relate to a high concentration of usage. To do this, I created Thiessen polygons, which essentially tells me trade areas, and these trade areas are those that are closer to one pump over the other. This tells me where people are most likely to go to get their water. For example, people in the Warwick trade area, which is in the left lower corner, that left pump, are most likely to go to that pump over the Broad Street pump. Now, I know looking at this map it's kind of confusing from the calculated trade areas because it seems like there are some trade areas that are bigger than others. For example, that Warwick Street trade area, which again is that bottom left, is substantially bigger than the Broad Street trade area. But in my next slide, I will have additional data that will kind of solidify the fact that bigger trade areas don't always equal higher density of deaths. To solidify the fact that bigger doesn't always equal more deaths, I coupled the general trade areas that were created with the point density map of the cholera deaths, which is the blue one that you were shown before. In zonal stats, it gave me the mean number of deaths, which you can see here in each trade area. What it clearly tells you is that even though trade areas might be bigger, that doesn't necessarily mean that there are more deaths. This is most likely due to the distribution of water companies and which companies were supplying water at that time. Because Warwick is bigger and because it is supplied by probably less contaminated water than Broadwick, it doesn't have as many deaths. Therefore, bigger doesn't always mean better, but this map does solidify the fact that Broadwick Street has a very high density in its trade areas, in its overall location, and it is located in the central tendency. Based on the data supplied from John Snow's research, using ArcGIS, I was able to recreate and come to the same conclusions as he was. Therefore, John was correct in his assumption that Broad Street Pump was the root pump spreading cholera in the district of SOHO. And as John Snow is the founding father of epidemiology, if his data had been wrong, it may have taken us longer to develop this new branch of study, which is very integrated while at the same time can differ greatly. As you have seen before, we can integrate epidemiology into other aspects of our life. So in conclusion, I think it is important for John Snow's research to be correct. If it had not, we would maybe have turned our back on epidemiology and figured this out later in life, and we wouldn't be where we are today. The data layers used in this study were provided by Rusty Dodson at the National Center for Geographic Information and Analysis at UC Santa Barbara. These are the citations that I used. I do recommend you going to look at these if you are interested in how epidemiology has aided our sectors of our lives, especially the last one. It's really interesting, so go and take a look at it. And that is all I have for you today. Thanks for stopping by and seeing my historical accuracy of Jon Snow and the conclusions I came to. Thanks for listening.